In previous section, we discussed how important exercise is to our bone strength, mental strength, and muscle strength. And I also emphasize that by exercise, I don't mean doing heavy job. It's doing ordinary job that you used to do that will keep blood flowing in your vessels and will strengthen your bone to avoid conditions like we discussed, compression fracture of in recapitulating what we have done before, we have said that breast cancer should be screened every 2-3 years by a mammogram or by bone density every 3 years. If mammogram shows abnormality, bone density will test the density of the bone, the severity of osteoporosis that you might have had. And we have said that pap smear should be done yearly or up to 3 years, depending on your risk profile and what your doctor or nurse will tell you what to do. And the lipid profile, we have said it must be done every year to check your lipid changes if you are in menopause. The same as dental checkup is done every year. The general checkup of the whole body, your GP should do annually to check the risk profile of all the above entities. General checkups will check other things like other diseases like diabetes, arthritis, hypertension, and etc. But now, in this segment, the big question is, the Bible tells us that when Adam and Eve, after they've eaten an apple that they were given by the snake in the Garden of Eden, they realized that they were naked. By naked, I mean the whole body was naked. But they chose to cover a certain portion. Why didn't they cover the eyes, the chest, the abdomen, or the feet? They covered a certain part. They covered their genitals. That tells us that even from the Bible, the genitals are the most important part of the human body. Actually, in a woman's body, the most important is a genital. What depicts you to be a male or a female is because of the genital. That's what differentiates between a man and a woman. So we're going to start to discuss the effect of menopause on the genital system. As the genitals have shown here that even from the Bible that is the most important part of the human body. If you look here, you find that these are the muscles that covers what we call pelvic diaphragm or levator ani. The genital floor, pelvic floor, where all organs are lying in. If you look at from below, this is the anus, which has got the sphincters, the valves that keep the feces inside. And in here, we've got the urethra and the vagina. They also are covered or bounded by muscles. These muscles are called the pelvic floor. And around each opening here is the sphincters, the valves. We've got vaginal sphincters, which constrict or to control flow out of the urethra, the vagina, and the anal sphincter, which control the release of excreta, anal excretors. The menopause affects all those muscles and the sphincters. You will see the effect in other things. This effect of menopause on the urinary and the genital system is referred to as urogenital aging. Urogenital aging can lead to consequences like urethral evasion. To show that you've got urethral evasion, there are symptoms that one will see. Symptoms like when you urinate, the urine is always burning, irrespective of whether you've got urinary tract infection or not, because the pH of urine is naturally acidic. If the urethra is everted, the mucosa is exposed to the acidic environment of the urine, so it's always burning. The other is prone to urinary incontinence. As I've said, those are the sphincters that keep the bladder from leaking, the anus not from leaking, and the vaginal integrity. If menopause affects those muscles that we've seen in the previous slide, the sphincters get loose, so urine comes out at any action that increases intra-abdominal pressure, like coughing, sneezing, or picking heavy object or laughing. The other is vulval atrophy. Vulvar atrophy is part of the urogenital aging that all parts of the vulva, they atrophy, they become small. From mons venereus or mons pubis, realize that the area where there's pubic hair becomes smaller, the pubic hairs become sparse, and the fat that used to be there to cover the pubic bone, it becomes thinner. So the bone is nearer the skin there. That's other thing you realize that during reproductive years, the bigger labia, the labia majora, are always bigger than the minor labia. But as you get into menopause and estrogen deficiency, you tend to have genital shape like a prepubertal child, a child that has not reached puberty, where the labia minora, the smaller labia, are more prominent than the major labia, labia majora, which means your genitals becomes infantile genital. And with that, the cervix and the uterus become small, it becomes atrophic, such that looking with a speculum, the cervix, which should be a protrusion inside the vagina, it becomes shorter and sort of flushes with the vagina, which makes taking a pap smear very difficult. Sexually, it makes, because the cervix is also an erotic sexual organ, it makes orgasm very difficult to be attained because it's shorter and it cannot be stimulated. We also have, if the genital hiatus, which is an opening through which the genitals come through the pelvic diaphragm, is also weakened, we have the organs that are supported by those muscles protruding through that opening called genital hiatus. So the uterus tends to fall down, the bladder seems to fall down, the rectum seems to fall down. You find that everything falls down, and it can even be visible at the vaginal orifice. It's what you call genital prolapse, which will be discussed in the other sections in details. With that, you might have incontinence of feces. You find that you cannot maintain feces very well, or even if you wipe yourself, you find that the anus doesn't close very properly. It becomes incontinence even in the absence of diarrhea. The changes that happens, atrophic changes that happen in the genital organs, are those I mentioned, plus this previous one, uterine atrophy, which I told you that it coincides with the cervical flushing, with the cervix flushing with the vagina, which makes pap smear difficult. And you have a condition called atrophic vaginitis. Atrophic vaginitis means the vaginal wall that has thinned out is atrophic, is very thin. And being thin like that, it doesn't secrete glycogen. It doesn't secrete a lot of secretion, more especially during sex. So it leads to dry sex. And you have got craurosis vulvae. Craurosis vulvae means the skins of the vulva is prone to many dermatological conditions like dermatitis, lichen sclerosis. We find you've got sores, abrasions, scaling on the skin of the vulva. It might be on the labia majora, labia minora, or on the mons pubis, including the perineum, where more especially on the mons pubis with sparse pubic hair, you tend to have a lot of infections there. The urinary system also, the urethra becomes hypermobile because of the ligamentous atrophy and the atrophy of those muscles that makes the urethral sphincter. If it becomes hypermobile, it forms a condition called urethrocoel. Urethra seem to protrude inside the vagina, and with it, it pulls the bladder. The bladder descends inside the vagina, such that when a woman urinates, the amount of urine become decreased. That's urinated. So more of the urine remain inside. So it's got increased what you call increased residual volume of urine. When you urinate, you don't urinate all the urine. Residual volume, the volume that remains inside the bladder becomes more than the one that you urinate. And as it stagnates there, it prones you to renal stones, you develop renal stones, or sometimes it urine flushes back through the ureters into the kidney, which is called reflux, and it causes urinary tract infection, which can also cause renal stones in the kidney. Of that accompanying process, which become more visible during menopause, is incontinence of urine. Skin of a menopausal woman with thick, with glycogen, lot of secretions, and this convolution which are called rugae, and that of a postmenopausal woman which is thin and straight without rugae. Will come the rugae, and it doesn't secrete much as such. This is demonstrated here in a premenopausal woman. The rugae are demonstrated here. If the rugae are prominent, the blood flow to the vagina becomes more, and the nerve sensation becomes more, such that the vagina can expand to any size. It can even lengthen to any size without being painful. While in menopause, it is thinning of mucous membrane, loss of those vaginal rugae, and shortening and stenosis of the vagina with decreased sensation. All this cascade which happens on the vagina during menopause, it leads to dry sex, painful sex, with sometimes bleeding, and all in all, it leads to loss of libido, loss of sexual drive. With that loss of sexual drive comes many problems in the family. It comes to a problem where the partner, the male partner, if is sexually active, it leads to family problem. He looks for alternatives outside, because you can't keep on sitting next to somebody who's moaning because of painful sex, dry sex, and you call them blessers. You call them blessers because you are rejecting them at home by not attending to your menopausal symptoms so that you can adapt well to the family activity. That I have mentioned previously, that hormone replacement therapy, HRT, can to some extent solve these problems of dry sex, painful sex, of libido. As I have said, that the effect of estrogen on the vaginal tissues to maintain the collagen content and the thickness and the elasticity of the vagina, that it keeps the vaginal surface moist and maintain good blood flow so that vaginal wall can secrete. It keeps the epithelium of the vagina rich in glycogen, which keeps the lactobacilli, which convert glucose to lactic acid, keeping the vaginal pH low. If the vaginal pH is low, then you don't have episodes of candida or thrush coming in, because fungi don't want to live in an acidic media environment. The acidic environment protects against vaginal infection and urinary tract infection. This, what you see, is a picture of a normal premenopausal or a menopause who is taking HRT, the picture of the vagina with the rugae, which increases the surface area of the vagina, which can make the vagina to attain any length if stretched or any diameter if stretched. So it avoids that painful sex and dry sex and bleeding. To summarize, vaginal atrophy, we said it increased the pH, and that lactobacilli, which are secreted by the normal vagina, we said it negates this problem. Agency. In menopause, because you've got atrophic tissues, you've got this agency. Agency means when the urine is full, you have to go to the toilet. You've got this irresistible urge to urinate that if you don't go to the toilet at that moment, it's going to release. You're going to wee on yourself. And always, in conjunction with that urethral evasion, you will have dysuria. Urine will always be burning, which sometimes, if accompanied by bacterial infection, you'll have bacterial urethritis, which leads to a postmenopausal woman always having burning on micturition, which is called recurrent urinary tract infection. Urethral carankle is also part of the evasion of the urethra because of lack of estrogen on the urethra, which falls under the cascade that makes the urethra unable to keep the urine and leads to urinary infection. Postmenopausal most common complaints are this: vaginal dryness, itching, discharge, which sometimes doesn't smell very well, painful sex, vaginal bleeding, especially after sex, even with normal pap smear. Unlike hot flashes, these symptoms, they do not improve with time. They just become worse and worse and worse until you retire from sexual intercourse because of this symptom. Not because you say you are old enough now you can retire, because you have got symptoms that can be treated and be managed. If managed appropriately, you can live a normal, accommodate any organs. But that does not replace HRT, which is easy and cheap in relief of postmenopausal symptoms and maintenance of quality of life and prevention of osteoporosis. Thank you very much.